Hi everyone, thanks for having me.
So you probably all know Kate. She's a member of OzSAGE. She has a long list of accolades and titles, and which are testament to her passion and commitment to occupational health and safety. She's president of the Australian Institute of Occupational Hygienists, Churchill Trust Fellow, one of the top 100 women of influence named by the Australian Financial Review, Science and Technology Australia's Superstars of STEM, and most recently, Kate received the Order of Australia in recognition of her work in improving safety standards to prevent the lung disease, silicosis, as well as preventing COVID-19. And so we are very honoured to have her here today. Her expertise, I think everyone will benefit from, and we're looking forward to quizzing you and having a chat. So my first question relates to the tweet you sent recently, and it announcing your Australia Day honours, and which were awarded to you for your service to workplace health and safety. And you wrote that illness and disease is not inevitable, and everyone deserves a safe workplace. So I just was interested whether you could talk about these comments in relation to what's happening currently in Australia, where we're expected to accept unreasonable trade-offs. Our government is expecting us to accept unreasonable trade-offs, that is inevitable transmission in our schools, and whether you could further comment about what the law says about what we're entitled to demand, and so the sort of differences between the tolerance for risk under the law and the tolerance for risk that our politicians are trying to enforce. So Kate, I'll hand it over to you to answer that.
Okay, so that's a lot of questions. Okay, that's fine. So I'll do my best to get it all in there. So first of all, thanks so much for having me. It's an absolute pleasure to be with you this evening. I'd like to also pay my respects to elders past, present and emerging. And I'm also on Gadigal land, so we must be very close. So I guess first off, the tweet, illness and disease is not inevitable. Everyone deserves a safe workplace. It's really sad in 2022 that's a concept. It should be an absolute reality. I've spent more than 20 years on construction sites and sites in the infrastructure sector and mining. And sometimes that's an absolute given. People come to it knowing that their employers and everyone around them wants to keep them safe. But unfortunately, I've learned during the COVID-19 pandemic, that type of want or will doesn't exist in every sector. And I acutely learned that really trying to put better protections in place for our amazing healthcare workers in 2020. And I've seen the dramatic improvements in healthcare in relation to the construction sector. So that's pleasing to see. So the next challenge is schools. Absolutely, everyone deserves a safe workplace, regardless of where they're working. And that absolutely includes our amazing teachers and staff who support our fantastic education system, no matter what type of school that you teach in or support or send your children to. So it's not just a concept that I'm really passionate about, it's also enshrined into our work health and safety framework within Australia. So I'm in New South Wales, obviously. Within our own work health and safety regulation, employers have a duty of care to ensure a safe workplace. But there's this additional phrase that comes at the back of that. And that additional phrase is called "so far as is reasonably practicable." So you have a duty to ensure a safe workplace so far as reasonably practicable. And sometimes there's not some great understanding of, well, what does that mean? So far as reasonably practicable doesn't mean what you feel like doing or not doing, what you have funding for or not funding for, what's in the public health order or not, or is. But sure, they're considerations, but that's not the definition of what is so far as reasonably practicable. So that's the second element of your question. Your third element of your question was around risk tolerance. So everything in our work health and safety framework, which is all state-based, so in this state, in New South Wales, is performance-based. You rarely find prescriptive legislation or regulations that tell you exactly how to meet your duty. It's like more performance-based regulation, which is entirely based on risk. So the higher the risk to a worker, the more things that have to be put in place to lower that risk. Just being in a high-risk work environment and saying, well, that's all I had available, isn't good enough. That's not enough to discharge an employer's duty under the Act. They actually have to go above and beyond. So I guess the easiest example is healthcare. So when workers started getting sick and they're only wearing surgical masks, I mean, for an airborne disease, it's not what is reasonably practicable. We have to increase our level of protection, ventilation, HEPA filtration, high-grade respiratory protection. If we translate that to schools, we know that we can't eliminate COVID transmission in a school environment when there's people in the school. But there's a layered approach that must be followed to ensure safety so far as reasonably practicable. And there's a whole, you're probably all familiar with it, there's a whole framework of which we work under as occupational hygienists and safety professionals, known as the hierarchy of controls. So you start with the most effective controls first, and then you work your way all the way down to personal protective equipment or PPE or masks, for example. And the reason that it's a framework or it's a system and it's not individual things is because we recognize that not any one thing is perfect. And so you need layers of redundancy. So the hierarchy of controls is a framework, it's like the Swiss cheese model, to go, well, you've got to put all these reasonably practicable things in, and then you've got to reassess the risk. So if the risk was high and you put all these additional controls in and they don't lower the risk, well, they're not the right controls, are they? So you've got to reassess the risk and go, well, is that risk acceptable? And then make a decision to continue that work. So hopefully in a roundabout way, I have answered your multifaceted question, Jane.
Yes, you have, Kate. Thank you. And I mean, I think I'm really interested in the concept of the hierarchy of controls and sort of maybe digging in a bit deeper there, because at the top is elimination, and that's kind of, you know, the idea is that you work through the layers and then deploy each before you move to the next. I mean, that's my understanding of it. And so at the top is elimination. And you know, under the current situation in most states in Australia, with very high levels of community transmission, this has been completely disregarded as a control measure, it seems. I mean, it has. And I just wondered, I mean, it just totally blows my mind that we're in a situation where kids are being sent to school, some kids with very few protections. And you know, what your thoughts on that are?
Well, I think that there's a lot of things that can be done, and in fact have been done in some areas to make schools safe. So when I say safe, I say it in sort of a public context, because we know that there's no fine dividing line between what's safe and unsafe. It doesn't exist. It's all a spectrum, right, of the lowest risk possible. So I guess I'll give you my example of best practice in a school environment, because as a hygienist, we're focused on the workers, which are the amazing teachers. So no good just keeping the children safe if the teachers are unsafe. It doesn't work that way. The work health and safety framework within our state focuses on workers and visitors and other people to the workplace. So it's everybody. So best practice. Best practice would be the option of sending kids to school or not sending them to school. So having both options, flexible learning and having a face-to-face environment as well, but having the option of choice. The next thing would be a focus on safe indoor air, because that's incredibly important. We know that COVID-19 is transmitted from person to person in a number of ways, and a key way is through aerosols, which we call airborne transmission. And how this happens is we as humans breathe, speak, sing, and we generate these microscopic droplets that are incredibly small. And within those droplets is the SARS-CoV-2 virus if someone is infected with COVID-19. And those droplets can build up and accumulate in indoor spaces, or they do build up and accumulate in indoor spaces. And if we have buildings or classrooms or staff rooms or bathrooms, toilet ablutions with poor ventilation, those aerosols just stay there because they're so small. They don't just magically drop out within 1.5 meters. They can stay in the air for a day or more. So if we have really poor ventilation and someone else comes in that space and breathes in those aerosols, that's how they can catch COVID-19. So that's why safe indoor air is important. So a focus on ventilation, that means a physical person has come into the school, so not an audit of a desktop with some drawings, but like a human has gone in, qualified human has gone into a school and done a ventilation assessment of all the places that are occupied during normal occupation. And determine what additional measures need to be put in place to lower that risk. And in my experience, that typically involves working with mechanical engineers to increase heating, ventilation, and air conditioning systems for those schools that are fortunate enough to have that facility. Or if not, the use of portable Hepa air filters is a really simple, I know it's not simple in some cases, but it's a simple proven technology that removes aerosols from the air. The next element is cohorting. Students and cohorting teachers, because what's the point in all this focus on children, which, don't get me wrong, is incredibly important, but then we put all of the teachers into one staff room to have lunch together all at the same time and then create this big super spreading event and all our teachers become ill. So cohorting our classes and cohorting our places where our amazing staff can have breaks and lunch that aren't together. The next element is rapid antigen testing or some sort of surveillance testing, because that helps keep COVID out of our schools. We know this isn't 100% effective. Again, none of these measures in isolation are 100% effective. That's why there's so many of them, but it's still a very important control measure. The next element is around density. So how many people you have in a space. So when you have packed classrooms, you have lots of people, you're going to have a pretty amazing ventilation system to overcome that. And generally, like, that's impractical. So we're looking at, well, can we actually use bigger spaces? Can we use school gyms instead of, some smaller areas for certain activities? Is that possible? What can we do to move things outside or move them to bigger spaces within our schooling system so that we don't have large amounts of people in a small space? And lastly, it's about masks, because that prevents short range transmission. I have 3 children myself. They're terrible at physical distancing, absolutely atrocious. So as we all are sometimes. So yeah, masks are incredibly important. So, and the higher grade the mask, the higher your level of protection will be and the lower your risk, which is why at OzSAGE we advocate for the use of respirators. So N95 or P2 respirators, or you might have seen us talking about KF94, which is like child size respirators as well for children. And all of those measures put in place help reduce the risk to a level that would be seen as acceptable, because you've done everything reasonably practicable. The challenge comes about, and I will say I've seen this, I'm really fortunate, I send my kids to a school that has all these things in place. But the challenge is when you see that and you go, well, it can be done, it's obviously reasonably practicable, everything's put in place, and then you turn around and you look at another school and there's just nothing. And when I say nothing, there's no ventilation assessment, there's no Hepa filters, mask wearing not really going on, cohorting not really there. And that's really, for me as a hygienist, that's the really sad bit, because you just see the divide getting bigger and bigger. And you see safe schools and you see schools that potentially are significantly more unsafe. And from our perspective, everyone should have the same level of safety regardless of where they send their children to school or regardless of where they teach or support in a school environment.
Thank you, Kate. And I think my concerns are around equity, and particularly, as you mentioned, one of the highest level control is the ability to keep your children home, and that's one of the sort of advocacy campaigns at the moment that COVID safe schools are focused on. And I guess that choice is something that is not available to everyone. And I think you mentioned when we were chatting in the lead up to this discussion that you were a child in a working class family, and that your parents both worked, and if you had been at school experiencing a pandemic, that you would have been one of those children who were without the protections, and potentially your parents wouldn't have had the choice to keep you home. And so I mean, I think that's the dilemma a lot of people face, and how, I guess, how do we deal with that level of inequity? What is sort of the how do we deal with that?
Absolutely. I'm so fortunate. I grew up in like the most amazing family, working class family. You know, it's incredibly loving. But yeah, my parents didn't have the opportunity to go, oh, we'll just keep you home today. They were out working, so they would have had to send me to school. And I highly doubt that the school I went to has done much in the way of a focus on safe indoor air, or any of the things that I've talked about when I'm talking about best practice. So unfortunately, there is a divide. And what, in my experience, that divide is just getting bigger with the COVID-19 pandemic. And I think something that's really important, I think for me, is, you know, we see parents being quite anxious about this. And I get it. I think it's the normal, appropriate feeling to feel anxious when you feel like you don't have a choice, because you kind of don't have a choice. And that anxiety, you know, our kids see it, they will feel it, and then that potentially has an impact on them as well. So safety in the workplace is not just about the people that are occupying that workplace. It has a huge ramification to everyone that interfaces with that workplace, and schools are the perfect example of that. That's why we're all so passionate about making sure that our schools are the safest that they can possibly be, which I guess is why, you know, back last year, you know, at OzSAGE, we really went hard on guidance and providing really what I hope you see is quite simple yet effective tools that people can use to, you know, reduce risk, because that's what it's all about, reducing risk in that environment. And thankfully, we've seen some states really, like from a public school system, take a good approach, and you know, ordering HEPA filters, getting HEPA filters into class, masks for children, providing masks at school, you know, treating that whole masking kids issue with kindness rather than politicizing the issue. So we've seen some great things, but we've also seen some really bizarre, not great things. So I don't know how to say it, you know, we've seen commentary that potentially HEPA filters aren't useful. I mean, this is proven technology. You know, we've seen, you know, audits done, they're called audits, but they're just a desktop exercise without humans coming in and doing an appropriate assessment. So we're seeing lots of things, but really at the end of the day, every employer, every school, everyone has a duty to ensure a safe workplace. So we've got to come back to that. Like everyone deserves a safe workplace. Every employer has a duty to provide it. And there's a lot of practical things that can be put in place to ensure that duty.
Yeah. Okay, thanks, Kate. And I think there's a few questions. I don't know, Elizabeth, because you dropped out for a bit. Maybe we could get, are you ready to ask the questions? Or
I've got a few questions, and I posted in the chat and asked people to repost any questions previously because of my technical issues. So I've got a few questions to put forward. If anybody has any more, please just type them up. So the first question is, do you have recommended ventilation assessors to advise or help principals arrange such for schools in Sydney?
So the Australian Institute of Occupational Hygienists holds a consultant directory. So on the website, which is aioh.org.au, there's a consultant directory of which you can go in and tick ventilation, and then all the consultants and the state and the consultants that perform ventilation assessments will come up.
Okay.
So yeah, that may be helpful.
We might send out that link in a follow-up email. Okay, and next question.
So the next question for Kate is mandatory masks for primary kids.
Yeah, so the risk of transmission of COVID is still present when you're a primary school student or if you're a high school student. I do recognise this isn't easy sometimes. I have a son in year 4 now, and can you imagine my horror when it took me over 2 weeks to get him to wear a mask effectively? I was like, oh my goodness, I thought this would be far more easier than it actually is. And it took a lot of trial and error, but I think just approaching it with kindness, and the same way that you always do as a parent when you're teaching your child how to put their shoes on, or, you know, who's a boy wearing pants, you know, is a big deal. You know, all those things that we do as parents to help our children participate in day-to-day life. You know, mask wearing in primary school is really important. So there's going to be times where it's not practical, when they're eating, when they're running, when they're outside, absolutely. And it's not always going to be perfect, but every moment that the child wears a mask, it's reducing the risk. So I guess look at the wins when they are working, and when it's not working, just like you do with everything, approach it with kindness, have that conversation with your child or with another with the person, and try to explain why it's important. It's important to protect them, and it's important to protect the other children and their friends in their class, and also their teacher.
Okay, thank you, Kate. And I think there might be more questions about masks potentially. I'll hand it back to you, Elizabeth.
So Kate, the next question we have is, how do KN95 masks compare to the N95 and P2, as that's all we've been able to find recently? Thank you.
If that's all you're able to find, then that's all you're able to find. You got to deal with what you've got. N95 respirators are certified to the US standard, very high standards, and they've got a really good quality control system in place. P2 respirators meet the Australian standard. It's a high, I would say better, but I'm biased. Another standard similar to the US standard. The reason I say it's a little bit better, it includes elements of fit. The US standard doesn't. So technically, the standard that relates to the KN95 is very similar to the Australian and the American standard. The issue that we have is that the quality control has not always been there. And there's a lot of KN95s which have filtration that's been shown to be much less than advertised. But I get it's really hard to find them. It's even hard. I was out yesterday trying to find some more because I'm running out, and it is really difficult. So you just got to deal with the best that you can get at the time. And yeah, I mean, when other masks become available, other N95s or P2s, then start to replace the KN95s with them.
Okay, thanks, Elizabeth. Are there more questions?
Yes, there are a few coming through now. Thanks for that, Kate. So the next question is, if respirator is completely drenched with sweat, physical exertion, high humidity, high temperature, is electrostatic charge, hence filtering lost?
When a P2, N95, KN95, when any respirator is wet, it's not going to work effectively. So when it becomes wet with sweat, replace it. This is why I send my son to school with a mask and a few others in his backpack, because, you know, if he does wear it outside and he forgets and he's left it on, and then he's like, oh, okay, take it off. It's already sweaty. It's too late. It doesn't work anymore. So yeah, drenched with sweat or, you know, getting sprayed with water is going to render it less effective and need to replace it.
I step out the door and I'm instantly sweating at the moment with my respirator on, and I just say, I don't know. I wasn't aware of that, and that's quite frightening.
I will clarify. You know, sweating and having the filtration of the respirator wet are two different things. So I'm talking about the filtering media, like the mask itself being wet. So when that's wet, it doesn't work. But, you know, P2 N95 respiratory protection, just to put into context, we use this in underground tunneling and construction. They're designed for fit and healthy men to work hard in all day. So those fit and healthy men are sweating. So when they're working and they've got respiratory protection on. So sweating a little bit is okay. It's just if, you know, you're dripping into your mask, or, you know, that's when it's going to become a big problem.
Okay, so it's always worth over a day, if there's that chance of it happening, to have a spare.
Yes.
Yeah. And then that wouldn't be the case with non-disposable, so the ones that don't have respirators that are not disposable, for example.
Yeah, so reusable respirators, sometimes they're called elastomeric. They look a bit more industrial with the filters on. No, that just as easy as, you know, dumping the filters, getting new filters if the filters become wet. Very rare for those filters to become wet from sweating. Normally that's from, you know, being under a misting system, or it's raining or something like that.
Okay, excellent. All right, back to you, Elizabeth.
Thank you. Thanks, Kate. So the next question, would love your thoughts, Kate, about combining 3 classes in a year level in one room. So moving from 25 kids in a classroom to 75 kids in the former library. No natural ventilation discussed, air recirculated, no mention of filtration, etc., and a single air purifier ordered. The kids will be in very close contact in one small area, which is open for the whole cohort lesson. Okay,
so let's break it down. And it's going to depend on how big that classroom is and how big the former library is. But let's assume that the library doesn't have beautiful high ceilings, and it's an older style building with, you said it's got no natural ventilation, but I assume it probably has some windows that might meet the building code. Yeah, it's most likely going to be a higher risk scenario than it would be if you've got 3 classes separate, because you're already introducing more humans, more potential mixing of people. I will say though that if this was a very large library with very high ceilings, and it does enable children to physically distance more than they were in the previous classroom, potentially it might actually be a lower risk. So that's why doing ventilation assessments of individual spaces is so important, and understanding what those spaces are used for. So just to break down, maybe just to explain some of the things we look about when we assess infection risk as an occupational hygienist. We look at the room size, we look at the way the room is ventilated, so natural ventilation or mechanical ventilation. We look at how many people are in the space. We look at how long they're in the space for. We look at what activities they're doing in that space. So being in a gym, they're going to generate more aerosols than if they're sitting down in a library. You know, we look at all of these things, and that goes into a massive calculation on infection risk. And if that risk is too high, then we start to take things out. So let's reduce the number of people. Let's bring in more ventilation. What else can we do to reduce that risk more? So I guess it's a difficult question to answer without seeing it or understanding how big it is. But on face value, a single air purifier, I don't know, is it really big? Have to be pretty big, does not appear to be enough.
The next question is, there's so much discussion of Hepa filters, and I've seen very little around HVAC. For those classrooms with ducted air cycling fresh air into classrooms, can Hepa filters be less critical?
Yeah, absolutely. So if you're in a building that's serviced by heating, ventilation, and air conditioning, or a HVAC system that draws fresh air from outside, the absolute priority is to engage with the mechanical engineers or the building manager who runs that HVAC system to get as much fresh air from the outside into that space as possible. So I've worked in buildings where we've been able to increase the volume and the rate and volume of fresh air from outside to inside by reconfiguring the HVAC system, which has increased the number of air changes and brought in much more outdoor air. And so those rooms haven't needed the provision of portable Hepa filters. I will just do an asterisk and go, this is different to a scenario where you have a room with a split system on the wall that recirculates that air. That is a very different scenario, those split systems that recirculate the air and keep the air nice and cool, they don't have HEPA in them. So they're just, you know, the air is just recycling through there, getting, you know, hopefully nice and cold, but building up all those aerosols in the space, which is why it's so important that we focus on getting outdoor air in. And when we can't do that, using additional interventions like HEPA filters.
Thank you for explaining that. The next question we have is, how much would it cost for a professional audit of a typical school, early learning, primary, high school? Thinking about either cost at a state level or cost for a PNC to donate funds. Our school PNC previously donated funds to air conditioning the hall, but offers of CO2 monitors and portable HEPA filters not accepted. Perhaps these would be considered if recommended by a professional?
I mean, at OzSAGE, we've recommended the use of CO2 monitors and portable HEPA filters as very simple strategies, but there are other ways to do it. You can do ventilation assessments, and in fact, occupational hygienists commonly do ventilation assessments, not using CO2 monitors, but using much more sophisticated equipment. CO2 monitors are just easy for people that aren't hygienists to access and also use. The question of how much it would cost, it's a really difficult question to answer. In my own experience, I'll be honest, I have volunteered my time throughout the COVID-19 pandemic, so I don't charge a cent if I'm not available because I'm very busy. But other occupational hygienists will go out and do a quote depending on how big the school is, how many rooms, what is it that you need to be done. So I don't want to speak for what other occupational hygienists would charge. So that's a really difficult question. But with regards to the cost of the interventions, the things that we would recommend, you know, upgrading a HVAC system, or, you know, I should just say reconfiguring a HVAC system to operate slightly differently is the cost of a mechanical engineer to come in and do that particular work. Generally not very high. CO2 monitors, a couple of $100. HEPA filters, well, it really depends how big and small they are and how many you need. Thousands, could be tens of thousands, depending on how big the school is. And it's really difficult because some schools are naturally ventilated, some are mechanically ventilated. The first thing that we would do is look for all of the cheap and easy options first, and then we start to work up to, I guess, the things that are more costly, because we want to do the quick and easy things first because they're very easy to adopt. And because this is me talking back in term 4, we knew that kids were coming back to school and we wanted it to get in place ASAP.
So how do you resolve the divide inequity? Lots of teachers I have spoken to also feel like they don't have a choice and cannot afford to give up work and therefore cannot keep their children home. So what needs to be done to ensure equity of outcomes?
It's a really good question. In my experience, individual voices are important, but collective voices are significantly stronger. So groups like this are incredibly important. Working with your union is incredibly important. Working with your professional association is incredibly important. Reaching out to your state work health and safety regulator, Safe Work New South Wales is the example here in this state about that. So they're just not giving up. So you may feel like your voice is silent, but every single voice is important. And collectively, every individual making a little bit of noise makes a lot of noise. Hopefully at OzSAGE, we've helped in some way by providing reasonably practicable guidance that can be put in place, and showcasing schools that have done, you know, really good things and showing that it can be done, and calling out things that are scientifically inaccurate, particularly when such statements are made by sometimes our state government departments.
What is your view on children wearing a P3 in a classroom? Can it cause damage? I have purchased some, but they appear to hurt a bit. What are your thoughts on that?
Oh, okay, well, if they hurt, that's not great. So please don't use them, because it shouldn't hurt at all a child. And maybe P3, I'm assuming, so just for context, I think you mean P2, but if you do mean a P3, I'll just put that into context of what that is. A P3 is a full face respirator with cartridges. So I'm assuming that's not what you mean for a child. So we wouldn't recommend that. That looks a bit scary, a bit industrial. if a P2 or a KF94 is hurting, don't use it. There's lots of other brands and makes and models. And it's all about trying to find the right one that's comfortable, because, you know, after a little bit of using it, you probably won't even notice that you're wearing it anymore, or your child won't notice that you're wearing it anymore. Sorry, my child's walking up the stairs. He's trying to hide. He's like, Mum's on a webinar.
Kate, the person did mean a P3 full face respirator. They did
Oh,
purchase
okay.
it.
Oh, okay. Well, for a child, I think that's a very high grade of respiratory protection. I will say they're not designed to be worn by children, because they are designed to be worn by workers, fit and healthy workers over the age of 18. It will increase breathing resistance, and if it is painful, then I absolutely would not recommend wearing it.
Thank you. How can groups like CSS make a good case for the reasonably practicable measures you describe, when the various departments of education say the risk of infection and spread is very low in children? Is there a way we can effectively counter this claim from a WHS perspective? Thank you.
Well, the Work Health and Safety Act and the framework is focused on workers and visitors, so I would push the focus towards the safety of the teachers, because the safety or the risk to health of teachers without COVID mitigations is significant, and there's still a primary duty of care provision that exists under the Act. There's provisions to ensure that the workplace is monitored for the purpose of preventing illness and injury to workers. There's a significant amount of clauses in the Act and regulations in our whole regulation within our state that are directly applicable to schools. And so I would focus the risk initially to the teachers, and then I would expand it out to the visitors of the schools. So everyone else that is there because the school exists, which is obviously the children.
Thank you. If one were to hire an occupational hygienist to assess just a sample of classrooms, 1 or 2, would the fees be in the hundreds or the thousands? So what figures would you be looking at?
I think it would be in the very low thousands to high hundreds, depends how many hours it would take and what equipment they would bring.
The next question is about masks for tweens. Any recommendation regarding masks for tweens? Pediatric size purchased online are too small, and adult has gaps and air escaping.
Yeah, it's I have tweens and I sympathize. It's really difficult. My tweens, my eldest actually wears a KF94 because her face is small like mine. And my 12-year-old actually wears one with a P2 or N95 type with ear loops. But they're all of them, they look similar, but all of them are slightly different. So if you have the opportunity to find different makes and models and brands, and I appreciate how difficult that is right now as I'm saying that, but if you have the opportunity to try to find different brands, then give it a go, because it's just doing the best with what you've got at the moment. Our supply chain, unfortunately, in Australia is not amazing right now, as we all know, but hopefully it gets better. And we've seen it get better over the past few weeks than it was in early January. So with regards to specific brands and makes and models, my kids wear all types. So we don't have a favorite. I have a whole stock of all different types of brands from different countries and different types. It's just really what's the most comfortable and what you can find.
So I am conscious of time. I'm just going to skip through and randomly ask a couple of questions. I'll start with this one. What's the benefit of CO2 monitoring if the school, my children's school, only does it just after the children have left the room? Will it still catch the levels accurately at all?
So the way to do CO2 monitoring is to put it in a space that's occupied and to leave it in that space during occupation. And then when people have left that space, you leave it in that space as well. So what you want to see is the CO2 level, what you will see is the CO2 level rising. You'll be able to monitor it while everyone is there. And when they leave, you should know, you'll be able to calculate how long it takes for that CO2 to go down after they have left the room. Now, all that information is really important. Going in to do a spot check, like, I don't know, a minute or 5 minutes or 10 minutes after people have left the space is not the appropriate use of that type of technology.
In your opinion, would a survey of precautions taken in different schools likely showing inequality be taken seriously by the media and policymakers if it was undertaken by families, or would it require professional input from the outset to be considered relevant?
I think that's a fantastic question, and I can't speak about what policymakers or the media would find interesting or valid. But I don't think that there would necessarily be a shortage of scientific professionals that would like to help parent volunteers undertake such a study, because I think such a study would lead to some very interesting outcomes that should inform future policy debate.
Okay. Hi. I think that's the last question.
I've got about 4 more, so
okay.
I'm just conscious of Kate's time. I'll be direct.
So we've got, I mean, it's up to Kate if she has time.
I've got I apologize, I do have to dash at 8. So hit me with your hardest questions and I'll do my best to answer them. I know I'll regret asking for the hardest ones, but.
Okay, let's see. In Victoria, state government has confirmed 682 students and 63 staff returned a positive test between 4 p.m. Monday and 4 p.m. Tuesday. The cases are spread across more than 380 schools, but all of them remain open. Should schools be closed while community transmission is occurring?
Oh, that's a fantastic question. Look, it really depends on if they tested positive at home and actually never made it into the school to start with, doesn't it? Or if they're infectious while they're at school. And the lack or the abandonment of contact tracing as a public health intervention measure, is really stark. Contact tracing is absolutely vital, and the fact that we don't really do it anymore, to me, is a huge disservice to school children and school teachers and indeed school parents. So it's a really challenging question. If I look back to 2020 or 2021, what used to happen is when there was a positive case, they'd shut the school and then they bring all the cleaners in to clean all the surfaces, which I also found bizarre as an occupational hygienist, given that the primary route of transmission is through the air and we're cleaning surfaces. But notwithstanding, it did provide time, I guess, for the air to be exchanged inside those places. I think I would answer it by saying it's a case-by-case basis. If, as a parent, I'll be honest, if my child was in a class and there was another child with COVID-19 in that class, then I would want to know immediately, and I would want to have the option of what to do in that scenario. I would want the information to be publicly available so that I could make a risk-based decision on what's best for my child and what's best for my family. And I'll be honest, I would keep my child at home for a period of time before I felt safe sending my child back to school after that type of event.
Can I ask the last question, and I think then we can say farewell and thank you. I just, in terms of what what's in the shadows, we have BA2 becoming dominant in countries around the world, and we've had it detected in Australia, and early studies early studies show that it's much more transmissible. We don't know its virulence, but it also seems to be that is immune evading sort of vaccines as well. So if it does become dominant, I think what do you see needs to happen or change in our approach to schools if no other settings change?
Well, I guess I I don't think the pandemic's over. So I don't think Omicron is it. I don't have a crystal ball. I'm not special. I just don't think it's over yet. If we look historically, it would suggest it's not. So all the interventions that I've spoken about are non-pharmaceutical interventions. They're all things in addition to vaccines, which I neglected to talk about the importance of when I talked about best practice in schools, which is absolutely part of the equation. But for me, that's a given that everyone is vaccinated, that is eligible to be vaccinated. So all these non-pharmaceutical interventions, Hepa filters, ventilation assessments, masks, safe indoor air, these all work irrespective of the variant that's coming for us. So they're all going to contribute to safer schools, regardless of the next variant that comes our way, which really at OzSAGE is why our strategies are around vaccines plus, because you need both to have a sustained, environment of which we can participate in day-to-day life. If all we focus on is vaccines, it's actually not going to be enough. Incredibly important, but we need to do more. But I will say that all this focus on safe indoor air is still important, even after COVID. So, I have heard that I helped do a ventilation assessment at a particular school, and I heard feedback from a teacher who said to me, the kids used to yawn in the afternoon when I was teaching this class, and they used to be really tired, and now they're not. And now I realize it's because the classrooms were so stuffy historically, and now they've got all this fresh air and they're wide awake. So if children are, tired because the air quality is stuffy, they're not learning to the best of their ability. So there's more benefits in focusing on safe indoor air than just mitigating COVID-19 risk. We're also mitigating all the other viruses that we used to live with, and helping to improve concentration levels and all those other things. So there are other benefits. So if there's, I hope there's more than one takeaway from this pandemic. There's many lessons that I hope that we have learned and put into place. But I guess on the topic of what we're talking about, it's how important a focus on workplace health and safety is, regardless of the virus or the variant that we're looking at, and also the benefits of safe indoor air long after this is all done. So hopefully that, in a roundabout way, answers your question, Jane.
No, that's a great way to finish, I think, our discussion. And I think indoor air, I don't think anyone really would have considered it before COVID as a particular work health and safety issue, or very few people really understood the consequences and the benefits of improving indoor air quality. And so, yeah, I think the investment in that, it just doesn't make sense not to invest in it. And so hopefully ongoing pressure from OzSAGE and ongoing pressure from COVID safe schools, we can shift how our government, our government's policies towards this. So I'd like everyone to thank Kate. Maybe in your reactions, I might shift it to different, no, actually we're on the right one, but there's an applaud reaction down in the bottom. And so while we're applauding, let Kate exit. But thank you so much for your time, and it was an amazing discussion, and really appreciate it.
No, you're welcome. Thanks very much for having me. Have a good evening, everyone. Be safe.
See you. Thank you. Bye-bye.